Can you explain to me when you would consider a biopsy in a patient with chronic urticaria?
Well, as a dermatologist, I will say it's exceedingly uncommon. There are occasions when I have a patient where I'm trying to rule out urticarial vasculitis, and although there are obviously some signs and symptoms that would often separate those, I do know that over the course of 15 years of practice, there have been a few occasions where I've done that, mostly to essentially rule out that as being a factor. I don't know that for my average chronic urticaria patient that a biopsy is particularly useful.
I agree. And I think unless the patient looks like they might have leukocytoclastic vasculitis or something else, then I wouldn't biopsy them. The other thing that struck me in your presentation is the duration of the disease. And I wanted to get your opinion. I mean, when I talk to patients about this, I have to convince them that chronic spontaneous urticaria is a disease in itself, and you don't necessarily have cancer or anything else with it. How do you approach your patients?
Well, I think that's really important what you mentioned. I think patients are accustomed to rashes that come and we can treat them and they go away. So I think these patients tend to be very frustrated with the fact that we can't just cure this. So I think the biggest thing is talking with them about the fact that to date, we don't have a cure for this. However, they will not have it for forever. And we do have good management techniques. So I think a lot of it is working with my patients to reassure them that we will find a way to manage the disease so they can get back to living their life.